The latest numbers now on the coronavirus. Globally, we are looking at cases nearing 3 million, with worldwide total deaths topping 207,000. Here in the U.S., cases are now closing in on the 1 million mark. U.S. deaths closing in on 55,000. And the total number of Americans tested so far, just 5.4 million and counting. Let's talk more about this now with Dr. Dara Kass. She is Yahoo's medical contributor and associate professor of emergency medicine at Columbia University Medicine. Dr. Kass, good to have you with us. We're hearing more and more about these antibody tests and how important they're going to be to getting the economies back up and running. The antibodies meaning that people probably had the virus and now perhaps have immunity to it. How important are those tests to reopening the economies?
So I think that the tests are important, first and foremost, to understand who's had the virus or who's certainly been exposed to the virus. How they'll play a role in reopening businesses, re-engaging with our community, which is how I view the opening of the economy, is still to be determined, because we're not really sure if the presence of antibodies actually confers immunity. What we know is that if you've been exposed to the virus and you make antibodies, those tests will hopefully measure those antibodies. And we're hopeful that once we can see who has had the virus and who has antibodies, we can then start to prioritize enabling those individuals to maybe start engaging with their community earlier than other people that may still be at risk.
Doctor, how would you pull off a reasonably successful restarting of the economy based on what you're seeing so far from various states? Are you pleased? And if not, what different steps need to be taken?
So I think that looking at a state kind of writ large to open all of its businesses, or certainly even all of one kind of business, is actually not really the approach I would use. It's much more about looking at the local community, the testing, the tracing, the disease prevalence, the ICU capacity, the hospitals, and then saying within that community, are they ready to start certain businesses? And each community may prioritize manufacturing or even like local smaller businesses, depending on what's a priority to them and where their economy goes. Obviously, cities like New York City are going to have different priorities than upstate New York. I think I'm encouraged by governors that are looking at their state as like a group of smaller communities that may make different decisions, rather than honestly a state like Georgia, which is making universal decisions when they have very rural areas and very urban areas with much different capacity to test and track. And honestly, their hospitals are at different capacities as well. So I'm encouraged by the governors looking at the system much more than the governors looking just to make like broad sweeping decisions just across the board.
Yeah, excellent point. But there are so many questions regarding these antibody tests. First off, are they reliable? And if you show to have antibodies, how long does the immunity last? And does that mean that you are still a carrier of the virus?
Those are a lot of very complicated questions. So first and foremost, it does seem like the tests that are being validated seem to be reliable insofar as the tests are consistent between, if you take the same person and you have them take multiple tests, the results are the same. Whether or not those antibodies confer immunity, like we said, is still to be determined, although most infectious disease doctors and immunologists believe that if you have antibodies, you have some level of protection. How long that lasts for is also to be determined. We know that viruses like this can have immunity, if you have immunity, for up to a couple of months or even a couple of years. And so that will help us guide if we get to the point where we're trialing a vaccine. That frequency may actually play into the vaccination timeline for a virus like this. I think the most important thing to realize is that the antibody tests are one more piece of information we're getting to understand how many people in our communities, in our country, have had this virus, have mounted antibody responses, and use that as another piece of information to responsibly engage in businesses again and restart certain industries that have been suppressed in order to address the virus and how it impacts our hospital settings and our communities.
All right, Dr. Dara Kass, thanks so much for bringing a little clarity to a very foggy situation. Appreciate it.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.